Johnson.
Senator.
Thank you, Madam Chair. By the way, good questions. I have the exact same questions. I think what we really need to do is work together and work with CMS to get the answer to your question in terms of what percentage really is fraud related, how much of the improper payments really are, paperwork violations, technicalities that are actually addressed by the suppliers and they get paid. I mean, we're missing some basic information. Again, welcome to big government. I appreciate Senator Baldwin's comments about not painting a broad brush in terms of the bad actors who we want to definitely discipline and go after versus the quality suppliers, throughout the industry. To that vein, we were working with the American Association for Home Care to try and get answers to some of these questions, get their perspective, and they sent me a letter I'd like to enter into the record with unanimous consent. An interesting stat that I came up with also that we found out is that when the payments are being adjudicated, 53% that were termed improper, or where there was, I'm not exactly sure what this represents, but 53% by an administrative law judge are actually overturned. So in other words, if they were basically judged by CMS to be improper, now 53%, when adjudicated, are actually proper. So I'm not quite sure what that tells us, but we've got a problem here. What I'd like to do is, again, this is welcome to big government. So, Ms. Stanley, you had some private sector experience. So I'd like to talk a little bit about the difference between the problems we're seeing here in terms of how do we get our arms around, how do we control waste, fraud, and abuse in a public payment system, big government system, versus how does the private sector do it? Because we're talking about Medicare fee schedules paying 3 to 4 times the rate, I guess, of private insurers. And I know a lot of people like beating up on private insurers, but they do something to control that. Can you just speak in general the difference in the type of fraud that private insurers are dealing with versus Medicare system?
I will try. I think that a lot of the issues are similar that you see on both sides. One of the big differences that I noted when I came to Medicare was that we had so much control, I guess, for lack of a better word, over our panel of physicians on the private side. If you're an HMO, you're controlling kind of that market and who you're letting into that program. I think that CMS has made extreme progress in heading in that direction with their more control over provider enrollment, especially around DME. The National Supplier Clearinghouse that Dr. Bedetti mentioned really has taken, I think, just leaps and bounds of better controls around how they are looking at providers and treating it much more like the private side.
But in the private sector, a private insurance company doesn't make payments on claims, and then auditors come in there and say, well, boy, 66% of those were proper.
Right.
I mean, what percentage would it be?
One of the advantages, I would not want to answer that, but one of the, because I've been out of it for some time, but one of the big differences, I think, as well, is things like pre-certification. Private insurers, will set up and they'll say, look, in order to get this supply or the surgery, we're going to have you pre-certify. Medicare is a fee-for-service program, and so we have not went in that direction. Of course, on the managed care side, you have HMOs, managed care for Medicare, but under the fee-for-service.
But also, you just have private insurance, and again, I know that some people just really hate the thought of profit, but it's pretty strong discipline in terms of controlling costs, isn't it?
Yeah, well, absolutely.
And the private sector does just a far better job controlling costs, preventing fraud within the private reimbursement system. Even though it's the third, again, and if you want to really know the root cause of the problem with the out-of-control healthcare spending in general, it's because we have separated the consumer of the product from the payment of the product. We did that back in the 40s, and we started the third-party payer system, whether it's government paying for it or insurance companies paying for it. The consumer of the product, by and large, does not care what something costs because they really don't have that much skin in the game. Yeah, there are deductibles, there's co-insurance, but in general, just give me the best, and we end up with that basic result. In terms of how the private sector operates, in terms of how they control those costs, talk about their auditing system versus what you're doing.
Wow. I don't know that it's that different. I mean, many times, you know, they're responding to complaints, they're doing some data analysis. In some cases, to be honest, I think it's, at least, and again, I have not been on that side of the house.
Okay, so let me change gears then. Let's talk about,
let's say something nice about
Oh, I'm sorry.
it's coming. Let her say something
okay, sure.
nice.
Well, I'm running out of time.
You can
go ahead.
Go ahead. That's
okay, no, go ahead if you're going to say something really nice.
I was going to say that I think that, you know, in some ways, you know, Medicare is so much more sophisticated. I mean, you know, when I came from the private side, you know, we based everything on how Medicare designed their payment structures, and that's really what we based a lot of our policy and procedure on, because Medicare was really so sophisticated in terms of, you know, the specific policies and in looking at, you know, medical necessity and those kinds of things. Not necessarily talking about the payment specifically, but just the way that you're administering that. And I think that, you know, looking at the data analytics side, the fact that we're trying to go, I think more, you know, CMS is looking more at risk-based, which sort of gets to your point, you know, of trying to look at where is the highest risk to this program, where are we going to get the biggest bang for our buck, and let's focus those resources on those areas. That also keeps us from sort of hounding those physicians or suppliers that are, you know, trying to do the right things.
Let me just move into the private sector side of the public system here, and Medicare Advantage. Talk about the fraud that we're seeing in Medicare Advantage in terms of reimbursements there versus what we'd see in Medicare and Medicaid. Because, I mean, my understanding of that is a, I guess, a voucher program, something like that, where seniors are actually buying private health care plans, and they've got a little more skin in the game that way. I mean, do we see the same problem in the, which is about a $232 billion a year program? Is that about accurate with Medicare Advantage? Dr. Budetti?
So the improper payment error rate, which is what we do measure across Medicare, is, I'm trying to remember what the number, I think it was on the order of 11% this year. But that, again, that's not a measure of fraud. Senator, because you're so interested in the private sector, and I'd be delighted to provide you with more information on this, we have launched over the past year and recently really moved into an advanced phase of an active, ongoing partnership with the private sector, with health plans, with the Healthcare Anti-Fraud Association, with the states. We are all now working together under a healthcare fraud prevention partnership, and this will involve everybody sharing information on who is perpetrating exactly which kind of scams, and we're very, very encouraged. The private sector plans and associations that are working with us are extremely enthusiastic about this, and we're building this as a long-term interaction that will mean that fraudsters won't be able to, for example, bill one health plan for 8 hours a day, bill another health plan for 8 hours a day, bill Medicare for 8 hours a day, and bill Medicaid for 8 hours a day, and get away with it because nobody's seeing 32 hours of billing. Because we'll be sharing the information among all of the payers and building the sophisticated analytics around the shared information. And so this is a very important step forward that, if you would be interested, we'd be delighted to provide you with more information on.
Okay, again, that sounds like a positive cooperation, coordination, but again, it's not speaking to the benefit of utilizing more of a private sector model where individuals have more skin in the game or more control over, you know, what they're spending, making wise consumer choices, versus the government just coming up with a fee schedule that is paying 3 or 4 times the cost of different types of products. And you know, my concern is you'll never make that system work, and I think that's really what we're seeing here in this hearing. I mean, Medicare is how many years old? And it's just coming to grips with some of these you know, really overpayment issues. But anyway, that's enough for my time right now. Thank you.